guys remember Kelly Osbourne from the Osbourne show?
Mm-hmm.
She's been out of the limelight for a few years. I didn't really even notice that she wasn't around, which I don't mean that in a bad way. I'm not the best at keeping up with.
Yeah, she did a lot of stuff for that
She
entertainment
did.
news stuff.
Yeah, she was kind of in radio silence for
person.
a few years, and she kind of popped back up in the news this past week because the Osbourne's video podcast is coming back.
Holy crap, that's her?
Yeah, that's her. Right, see, exactly. All right, so.
Who is she?
Exactly right. So just as Sarah is stupefied by the new appearance of Kelly Osbourne, so was the interwebs. And of course, this spawned a bunch of rumors of her having plastic surgery, which she was denying on some interview that she had. I can't remember if it was People Mag.
Like, I already know that, I would say it was weight, but she's already lost a bunch of weight, and we already know what she looks like.
Boom. So that's it. So she did in 2020 have weight loss surgery. She had a gastric sleeve. And she lost apparently 85 pounds.
Yeah, and like she looks great, but
she does look great. She looks good, but she was, and for her though, that's a lot. 'Cause she's only 5'2". I mean, if you're like 6'4" and you lose 85 pounds, I mean, you're gonna notice it. But when you're 5'2" and you lose 85 pounds, like that is a enormous change.
Yeah.
And so, because of that, and this is all per her in this interview, she said that she lost 85 pounds and she started to feel, good about herself. She started taking care of herself and doing the things to kind of, keep herself looking fresh, and it really did change her appearance. She looks way different, and so people were asking her if she'd had plastic surgery, which she was denying, and she did admit, and it's obvious, I think, in that picture, she's had some injectables done. Maybe she's had, some laser treatments. I mean, her skin looks a little bit different. Her lips look more defined. So yeah, I mean, to me, it's pretty obvious that she's had some non-surgical things done, but I mean, that's not plastic surgery, so her, denial of plastic surgery, I think, is very, very fair.
Yeah.
And so it kind of brought up a question about, is it common for people who have massive weight loss to have surgery? Have we ever talked about that?
Like,
maybe just touched.
What do you mean, like
so,
surgery? Like,
well, I mean, so
stomach.
When people do these weight loss surgeries, such as gastric sleeve, they do tend to be very effective, and so people lose significant amounts of weight. And as you guys, I would assume, are aware, when you lose weight, it does have effects to your body. I mean, it's the same principle with pregnancy, and why women who are done with pregnancy are have a higher chance of seeking out plastic surgery. That actually does hold true with people that have had weight loss after weight loss surgery. In fact, there was a study that I was looking at just this week that said after the patients lose their weight from a weight loss procedure, up to 90%, so 9 out of 10 people, consider seeking out plastic surgery.
Yeah, because of like the extra skin.
Yeah, that's exactly right. Yeah, due to changes in their body from skin. And so, when I'd heard that she'd had weight loss and people were talking about plastic surgery, I was like, oh, well, that sounds completely reasonable that she might have done it. And
like
she said she didn't.
Tummy tucks and stuff.
Yeah, so that's actually, you're exactly right. So the number one surgery that people get after significant weight loss is abdominoplasty or tummy tuck. And that makes sense because, a lot of people do tend to hold extra weight in the abdomen area. And when you lose that massive amount of weight, it is centered mostly in the abdomen for a lot of people, and then everything just kind of collapses and the skin doesn't look great, and sometimes there's enough redundancy of skin that it starts to affect how your clothes fit.
Yeah.
And so, not surprisingly, abdominoplasty is extremely popular, and honestly, I would say of my patients, and I do a ton of tummy tucks. I mean, I average about one a week usually when we're in our busy season, sometimes more than that. And I would say half of them are, probably a little over half are women that are done having kids, but a significant proportion are people who have had weight loss surgeries.
Yeah.
Yeah, we see lots of those people. The other thing that are really popular, especially for women, are breast lift plus or minus implants.
Yeah.
You get women who are used to having larger breasts when they were heavier, and then they lose the weight, and suddenly the breasts are gone, and they're really, if you never had them, then people, I guess, don't know what they're missing. They don't think about it as much.
Yeah.
But when your breasts were larger and you could fill out your clothes and your dresses and your bathing suits, people kind of miss that. The other two things that are somewhat common are arm lifts, where people get the hanging skin. I really do like those surgeries because they're pretty dramatic as far as the results, and they're pretty reliable. I do those pretty commonly, actually. And then lastly are thigh lifts, where people take up loose skin on their thighs. That's a little less common. I think of all of like the body contouring, I probably do the least amount of those. But there are people that get enough loose skin on their inner thighs that it becomes hard to wear shorts, or they just are so self-conscious about it.
Yeah.
That they'll seek out those we call them body contouring, which body contouring is just a kind of a wastebasket term for anything where you're.
Do you do like that for people's butts? But not like
It's harder.
Not like a Brazilian.
BBL.
Yeah, but it's like.
You can. So they call that a belt lipectomy, where you're basically going 360 degrees around. Like, so you're taking the skin off the front and the back. So I quit doing the belt lipectomy as one surgery, but I'll do it as two. Like, if you do it all at one surgery, it's pretty morbid, and it's got a fair amount of complication rate. And I know, as the older I've gotten in my practice, I just have less tolerance for risk. I mean, I'm just not afraid to tell people no at this point if they want too much. And so I don't know how many years back it was. I was like, I'm not going to do those all at once anymore. So, and fortunately, there's not a ton of people that need that extreme amount of lifting, but there are out there. And so, I occasionally will do tummy tuck on somebody to let them heal and then come back and finish the backside. And it can help out, you know. And what I was going to mention about these surgeries, they're not risky in that people get sick from them, but I will say that they are harder to get that perfect aesthetic result just due to the fact that people have lost all the weight and their tissues are stretched out.
Yeah.
You know, if you get a girl who had a pregnancy where they just didn't get totally kind of wrecked from it, I mean, you can make them look 18 again. I mean, that's totally doable. But when people lose 150 pounds, there are changes that, even though you can make it dramatic better, and the patients are very happy, it can be hard to make it look perfect.
Yeah, I could see that.
Yeah, but I do like doing them because, you know, honestly, the patients, I think, for the most part, that have lost these massive amounts of weight are very realistic. You know, they'll come out and say most of the time, like, I understand it's not going to be perfect. I just want to get better than this.
Yeah, they're just tired of seeing it probably, because they're like, I lost all this weight and I'm
now
stuck with this thing I can't get rid of.
Yeah, and so I love treating those patients because I think across the board they're all very satisfied with the things they do. And once again, I don't do a lot of crazy stuff, and I'm pretty conservative as far as not pushing the envelope on risk. So, you know, we have good outcomes, and I think in general people really do appreciate the body contouring surgeries. They're very popular right now because there's still a lot of those weight loss procedures that are happening.
Yeah.
So, interesting stuff.